Let's talk about just general blood flow through the body. And we're going to use our veins to bring blood to the heart. We're going to practice going through the heart and then use our arteries to take blood away from the heart. So veins always to the heart, arteries always away from the heart. Let's just start of going through the general flow as if we were to drive blood to the heart, go through it, and then away. So we'll just pick a general direction just to get the feel of how this would work. Remember, we take our veins, in this case, it's all the blue vessels in this picture, and get to the heart. So we'll start with just the legs. I'm going to use my lower leg vessels, and we're just going to use the primary branches at the tibia. So I have either anterior tibial vein or posterior tibial vein. So let's use posterior for on the posterior side. Posterior tibial vein will come up behind the knee, and then it becomes popliteal. So popliteal vein, again, the blue vessels. This is the same vessel. We just changed the name depending on where we're at in the body as a landmarking, and we've understand these terms when we started understanding just the basic landmarks of the body. Remember, it's the same vessel. I look at it just like driving down a street. When you turn on a street, it's the same road, and I make a left or right, it's still the same road. We just give it a new name because it's taken to a different area. The same with our vessels. So the posterior tibial vein is the same vessel as popliteal. We just give it a new name. So behind the knee, popliteal. I continue, same road, but now I'm along the femur. So femoral vein. As I come up along where we have the ilium, now we refer to this to as external iliac vein. External becomes part of my common iliac vein. And it's common because there's an internal iliac. But if I'm trying to get to the heart, I'm not going to make a U-turn. I'm going to take the path of least resistance. So I continue straight because internal iliac will drop down. So I go from external iliac to common iliac vein. That reaches to my primary conducting vessel, which is my inferior vena cava. Inferior vena cava is going to get me all the way up to the heart into my right atrium. So I go from inferior vena cava into my right atrium. Now I'm in the heart. Let's take a look at the heart as a review. So I brought in from inferior vena cava, and now I get into my right atrium. I got to get into my right ventricle. I do that through the right atrioventricular valve, or tricuspid. And then I come up from the right ventricle, and I'm going to go through the pulmonary trunk. I have to pass through the pulmonary semilunar valve or pulmonary valve to finally get to my pulmonary arteries. Even though they're deoxygenated, they're taking blood away from the heart, so they're pulmonary arteries that'll get me to my right and my left lung. Get that oxygen, bring it back into my pulmonary veins, even though they're oxygenated, now we call them veins. That'll dump into my left atrium to get me into my left ventricle, finally into my left side of the body. And I went through my left atrioventricular valve to get through that, which is also called the bicuspid valve. And then I'm going to run through the aorta, but I have to go through the aortic valve or aortic semilunar valve first. That gets me through the aorta, and now I can finally supply what we call like oxygenated or good blood to the body. So I go up the arc and then ascend in the aorta, so ascending aorta. It can descend, and then we can supply the lower part of the body, in other words, below the heart, or I can go up above. And so I have the primary three branches coming off the aorta. I have my brachiocephalic trunk, which is only on the right side for the artery. So I only have one. So this is my brachiocephalic trunk or brachiocephalic artery that'll lead to my right side to go the arm and the head. But then directly off the aorta for the left side, I have my left common carotid artery, which is the one in the middle, and then my left subclavian. So let's use these. And actually, let's go to the right side. So we're going to take our right side, which is our brachiocephalic trunk. That brachiocephalic artery is going to split. So let's go back to that. And I'm going to expand on that a little bit. So we're going to take a look at where we're coming out at this point on the right side. And now we're using our red vessels. So as we use our red vessels, we're going to expand here. So I'm going to open this up so you can see this a little bit. And where we're at is at this point here. We're leaving our brachiocephalic trunk, which is that artery, brachial referring to the arm, cephalic referring to the head. So as I come over here, then it splits at this point. So this is a trunk, because it's like a tree, it's going to split. It'll go into my right common carotid artery to start to supply the head and the brain. And then I can come over to the subclavian side. So as soon as that brachiocephalic trunk splits, right common carotid artery, and then right subclavian artery. Again, the red vessels. On the left side, remember I have them directly coming off the heart when I talk about my left common carotid and my left subclavian artery, when we talk about those three branches coming off the aorta. So if we continue on the right side, we come over from my right subclavian, because it's going underneath the clavicle, and then I wrap around and it'll reach axillary. So same vessel. Remember I said it's the same vessel, just as we change where we're at in the body. Axillary artery. Axillary comes down and it becomes part of the arm. So we call this brachial, 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 until it splits. And now we're using a new name because we're going to the radial side and the ulnar. So once we get down to brachial, it'll split. And if we're in anatomical position, we come down into the right side here, which is on my thumb side. So this is radial artery, and then this is ulnar artery. So if we were to supply good blood there, we're bringing it all back. We can go right back through when we looked at our ulnar vein, radial vein, that comes right back up through brachial vein, axillary, subclavian, but now we're going to dump into my brachiocephalic vein. There's two brachiocephalic veins for veins. There's only one brachiocephalic artery. So when I come off the heart, I have two brachiocephalic veins. Those are both dumping into the right atrium. For arteries, it's asymmetrical, that I only have one brachiocephalic trunk. And then I can supply all of that good blood by way of those vessels coming off the heart. So this is a general blood flow of just remembering, how do I get to the heart? I'm using veins. I take a straight shot the best I can. When you drive somewhere, you want to use the roads that get you best there. You're not going to make any turns. You're going to try to get straight to the heart. And then as I leave, I'm using my vein. This is a general overview of how do we get blood circulated through the body using the heart and our arteries and our veins.